cloud, so we should be recording. We are recording. So again, good afternoon, retirees. Thank you for joining us. We wanted to provide an informational webinar, an opportunity to ask questions, and then also to give information about the district's exiting of CalPERS and shifting to SISC. So we will get started today. I am introducing the panel. Hello, if I haven't met you all, my name is Crystal Leach. I'm Associate Superintendent of Administrative Services. I've been with the district now going on 3 years. We also, next slide, Brittany. Okay. We also have with us Edith Salvatore, SDTA President. We have Chris Shapoister here with AFSCME, Vice President, Chris. Vice President. We also have Lori Phillips here, who is our direct line of contact with SISC, that she'll be able to answer specific questions or make contact with you later to ask specific questions. And then from Claremont Partners, who has been our professional partner in this whole exploration of exiting CalPERS and finding a different provider, we have Devin Devine and Brittany King with us. So again, today's objective is to provide an overview of what that shift to SISC will look like, focusing directly on you, our Medicare retiree and any early retiree options. And I do see a couple names of people that potentially will be retiring soon. So hopefully this webinar will also address some of your concerns as well. Next slide. So again, today we're focusing on 3 areas. What the committee process was, we have been exploring this for a while and we'll give you some details about that. A brief overview of SISC and the other comparable plan designs that they have. And then the next steps and due dates to try to make this as seamless as a process as possible. So we will go ahead and get started. Go ahead, Chris.
So my name is Chris Poister. I've been with the benefits committee for almost since the inception, and just wanted to let you guys know that all of the stuff that you're going to see here today, we negotiated for this at the bargaining table. We were gracious enough to have the district allow us to be in this conversation. It was definitely a big process, and everybody with the retirees, the part-time employees, full-time employees, everybody had a view and a say and a vote in all of this stuff. So it was a fantastic process. And I'll also add that the CalPERS state retirement will not be impacted by this. So even though our retirement benefits are through CalPERS, moving to SISC for our insurance will have no effect on your retirement, including long-term disability that will not be impacted by CalPERS. And then I'll pass it over to Edith.
Hi, yeah, as Chris stated, we started looking in probably spring 2019, then got serious in the fall of 2019 on looking for alternatives that would help us keep money in the district rather than sending it to PERS, if we could find equivalent or better benefits for a lower cost. In those conversations, what's important for retirees to know is that we focused on making sure that not only would the coverage stay the same, but the exposure to price jump in the switch would also be covered, which the district agreed to. So you'll see that as we move along too.
Hi, everyone. My name is Devin Devine with Claremont Partners. My firm assisted with the comparison of the different plan options, including alternatives to SISC. One thing that we've been helping with is putting a lot of the analytical materials up on the website. Brittany, if you'd go back, there we go. So this is a screenshot of the district benefit website. You can go in your internet browser to the district's main website and click on the benefits department. And this is a picture of what you'll see. So to the extent that there's things that we don't cover today in as much detail as you'd like, you can go to the benefits website and find it there. A copy of this presentation will also be posted on the benefits website, so you can download it there. This particular screenshot is the red circle it refers to a couple of plans that would be for early retirees. For Medicare retirees, for some of it, you'll need to navigate to a different menu on the website. But if you get stuck, you can just call the main district phone number there and ask for benefits, and they can help you navigate to it, or find the information you need. But there's a lot of stuff out there on the site. And with that, I will introduce Lori Phillips with SISC to say a little bit more about SISC.
Hello, thanks, Devin. Good afternoon, everyone. My name is Lori Phillips, and I'm an account manager here at SISC, and I'm assigned to basically Northern California. So I work with many school districts in the north, and I want to share a little bit of information with you about who SISC is. SISC stands for Self-Insured Schools of California, and we administer benefits to over 460 school districts throughout the state of California. We are actually the insurance division of the Kern County Superintendent of Schools office. So all of our employees are either classified or certificated employees, and we operate as a joint powers of authority. So we're pulling resources together from many school districts throughout the state. We've been doing this for over 40 years, and we are not an insurance company. So just like CalPERS is a pooling resource, SISC is a pooling resource, but we focus only on school district employees and working with school districts. We don't bring in the municipalities, the fire department, the police department, and other agencies. We only work with school districts. So SISC is actually the largest risk sharing pool in the United States with a school focus. And with that, like public schools, we are subject to the Brown Act. So all of our board meetings are open to the public, and our financial statements are of public record. And we run in the best interest of our membership. So we're focusing on the value and the information, the products, the services that we can provide to our membership. We're not looking at the perks, the politics, or the profits. And a fun fact, actually, we insure over 325,000 members in 44 counties. And a fun fact would be that 1 out of every 1,000 Americans is covered by a SISC health plan. Brittany? So leading into the coverage and what we're going to talk about a little bit today, I'm going to share some general information for the retirees. So our retirees that are under age 65, you are going to be offered the same plans as the active employees. So within SISC, our early retirees and our active employees have the same benefit options, and those have been discussed earlier in presentations earlier in the year, and we'll talk about them again later, I'm sure. But I want to let you know that retirees under 65 will stay on those active plans. For retirees who are over 65 and are Medicare eligible, you are required to enroll in Medicare Parts A and B, and that includes your spouse or domestic partner. We want to make sure everybody's enrolled in Medicare who's eligible for Medicare. That way, Medicare can pay primary on the claims, and then the plans that we are providing pay secondary. So you'll need to enroll and stay enrolled in Medicare Parts A and B, which I'm pretty sure most of you are. And then we're going to need proof of that enrollment at the time you fill out your enrollment forms. So we need a copy of your Medicare card, your beneficiary card. Okay. And then for retirees that have spouse or dependents, rest assured that your spouse and dependents will be eligible for a plan. Okay. If one or more of your dependents are under age 65, you'll remain on the district plans. And then the person over 65 will need a copy of the Medicare card, and you'll have possibly different enrollment, maybe in KIPSA, Kaiser Senior Advantage, or the companion care that we're going to talk about. So with that, I'm going to turn it over to Devin and let him talk about the pathway that is between CalPERS and SISC.
Great. Thanks, Lori. Crystal, I saw you had a comment in the chat. Did you want to share anything with the group before I went on?
I did. I forgot to mention when we started that the Q&A and the Q&A button at the bottom of your computer screen or your Zoom login is open. So throughout the webinar, if you have any questions, please feel free to enter them in the Q&A, and we will make sure that we respond to those. Those will also be posted on the website as frequently asked questions as well. Go ahead, Devin.
Great. So one of the main concerns when moving from CalPERS to some alternative is, can we make sure that people keep their doctor? And what is the pathway for people to pick their doctor? If there's some different options out there, and all people want to make sure of is that they keep their doctor and it doesn't cost any more than it did before, then this slide should be helpful. So for this is just for the Medicare Advantage, Medicare retirees 65 and up. If you're currently in Kaiser Senior Advantage, you're going to stay in the Kaiser Senior Advantage product. So Kaiser is Kaiser, Kaiser doctors are Kaiser doctors. There's zero risk of disruption for Kaiser folks. There will be a couple forms to fill out to make sure that the transition is seamless, and we'll cover those in a moment, but big picture, Kaiser moves right over. For people who are in plans other than the Kaiser plans with CalPERS, there's more variety with CalPERS. So there's an Anthem PPO product. There's United Healthcare product through CalPERS, and there's PERS Platinum, which is also an Anthem product through CalPERS. We were able to look through to see how many Sequoia retirees were enrolled in each of these. And so we did the calculation and we compared it to Anthem Companion Care through SISC, which is on the right-hand side of the screen. And what you'll find is that the Anthem network of doctors is exactly the same for both. The one where it's worth checking in advance between now and October of this year is the United Healthcare Medicare PPO. 95% of those doctors are covered in the SISC Anthem Companion Care product. So there won't be any issues there. But to find out specifically for sure if your doctor is covered in the Anthem Companion Care product, if you're currently on the UHC, the United Healthcare Medicare product, you should contact Lori Phillips at SISC. We'll show her contact information in a moment, but contact her and she can go through verifying that your doctor is in fact part of Anthem Companion Care if you're currently in the United Healthcare or UHC plan. Brittany, can you go ahead and take the next slide?
Sure. My name is Brittany King and I'm with Claremont Partners. And I prepared the comparison tables that you're looking at now for these Medicare plans that are available through SISC. And so each comparison table has a blue section, which is the current CalPERS setup. as well as a green section for the SISC plan details. And so the single rate is shown on the table. It's in the rates column. It's followed by the district's contribution, which will be changing from $149 to $200. The next column then calculates the difference between these two to get to the employee contribution, which is shown here. So with the new calculation or the new contribution in effect, the end result is then calculated at this very bottom right part as the employee contribution change. So that will be the difference, either less or more, but in these instances, less from the CalPERS setup. So these scenarios are available from today's presentation materials that will be posted on the website that Devin mentioned earlier. We do have these tables done for the Kaiser population. You'll see the Anthem product and then the other second Anthem product as well. So if you have lifetime benefits, the district will be making payments to SISC on your behalf. If you don't have lifetime benefits, then the payment to SISC will be the full premium amount, and then the district will reimburse you separately, the new contribution. SISC does accept online payment for the premium amounts, which is great. You can set it up to do a recurring payment as well. The main difference for this situation from CalPERS to SISC is that SISC cannot be paid using pension funds. I do also want to note that if you have lifetime benefits, but you have any dependents, your situation will look more like the blue side of the screen, except your reimbursement will be the portion of the premium that's associated with the single coverage. And so the ways to pay section is complete at this point. If you have any other questions, please put them in the chat. I believe we'll move on now. Back to Lori for dependent eligibility documentation.
Thanks, Brittany.
Thank you.
So in the transition, moving from CalPERS into SISC, we will need all employees and retirees to complete an enrollment form. And if you do have eligible dependents, we're going to need the dependent eligibility documentation. So we want to verify that your dependents are valid for our SISC underwriting guidelines. And we want to do that through the process of having you provide the documentation for that. So I'll go over this real quickly. Spouses, we're going to require a copy of your 2021 federal tax return, just the first page with the financial information redacted. We want to see that you are filing married, filing jointly, or married, filing separately. Now we realize with retirees, sometimes you don't have a requirement to file an IRS tax return. And if that is your situation and you're not filing a tax return, then we are going to require that you fill out a marriage affidavit. And we'll work with Sonia through the school district to have you complete that. In that case, we're going to need a copy of your marriage certificate. Now, if you have been blessed and recently found a new partner in life and recently got married in the last year, then we are only going to look for your recent marriage certificate. For domestic partners, we do require that you are registered with the state of California. So we're going to be looking for a copy of that registration, that certificate of registered domestic partnership. If you have any dependents, dependent children still on your plan or covered, you can cover children, stepchildren, and or your adopted children up to the age of 26. We need their legal birth certificate or the legal adoption papers. If you have legal guardianship of someone under the age of 18, we're going to need the court documentation that establishes that guardianship. And then some of you may have a disabled dependent who is over the age of 26, but still on your plan. For SISC, whether you're enrolling in an Anthem plan or a Kaiser plan, we're going to require a copy of the birth certificate, the prior year's federal tax return showing that child is being claimed as your IRS dependent, proof of credible coverage for the last 6 months, and then there's going to be a certificate, a documentation, whether it be Anthem or Kaiser, that needs to be completed by the doctor to have the carrier update and certify that that is a disabled dependent for a period of time or for a lifetime, just depending on the diagnosis. Okay. So now I want to talk a little bit about the differences in the two plans that Devin mentioned earlier. So we have our Kaiser Senior Advantage Plan. This is for retirees over 65. And as you know, if you've been enrolled in Kaiser for a while, you're enrolling in an advantage plan. So you're assigning your Medicare over to Kaiser. And with those plans, this is just a brief illustration of what your out-of-pocket expenses would be. So medical providers, of course, with Kaiser, you're going to be using Kaiser providers. You must live in a service area, a Kaiser approved service area. There's no deductibles. You receive emergency care when you're out of the service area. You are required to enroll in Medicare Part A and B and stay enrolled. And Medicare is assigned to the carrier. So at some point you filled out a Kaiser election form and you assigned your Medicare over. Now, if you've already done that and you're currently enrolled in a Kaiser Senior Advantage Plan, you will not have to complete another Kaiser election form assigning your Medicare over. Kaiser's actually going to give us a transfer file to transfer the Medicare assignment. So we have referenced that under our pool rather than the CalPERS pool. So you will not have to get reassign your Medicare, but we will want a copy of your Medicare card. Keep that in mind for anyone who's over 65. So a no assignment to the plan. You have emergency care, services covered beyond Medicare. Under the SISC Kaiser Senior Advantage Plan, there is additional coverage for chiropractic and acupuncture care. It's a rider that we add to our plan. So that information will be included in the benefit summary for you. And then, of course, your prescriptions are all filled through Kaiser, 0 generics, no on that. And then prescription drug, is there a donut hole or a gap in coverage on your prescription drugs? Now, both of these plans require, and I'll talk about the Anthem companion care just a moment. Both of these plans, we will automatically enroll you in Medicare Part D for your prescription drugs. So when you're covered by a group health plan like you are, then there are no donut holes for the prescription drugs or no gaps in coverage. And so the answer to that is no. And then you have, we include a Silver and Fit gym membership, a discount program for our members. Also, we're offering the Anthem Companion Care. Now, the Companion Care is a Medicare supplement plan. And this plan uses US providers who accept Medicare assignment. So all of the plans that CalPERS offered, my understanding, were Advantage plans. So they took Medicare assignment. So under this plan, those providers would also be accepting Medicare assignment and applicable to your companion care. Now, you do not have to live in a service area for the companion care plan. You just need to be in the United States where Medicare is acceptable. There's no deductible. There is emergency services are available within the United States. Now, if you're traveling elsewhere, there are some benefits under companion care. You do have some coverage, but you can look at what that coverage is under the benefits summary when we get there. It does require continuous enrollment in Medicare Part A and B. You do not have to assign your Medicare to a carrier. Okay. How this plan works is Medicare, or excuse me, your provider of service is going to bill your original Medicare. So you're on an Advantage plan now. Your Medicare is going to be released back to you as of January 1. So your providers will bill Medicare as primary, and then your companion care will pick up and pay secondary. And we'll talk about those benefits in a moment. Emergency care when traveling is available. There is no services beyond Medicare. So if Medicare does not cover something, your companion care will not cover it. Okay, so keep that in mind. And then we have your prescription drug coverage for this plan will be through Navitus Health Solutions. So that's our pharmacy benefit manager for our prescription drug benefits under the companion care. And then there's no donut hole on prescription drugs or anything else. Next slide, Brittany. So some general transition. We're going to have a special enrollment period. So these plans will go into effect January 1, 2023. So in October, we're going to have an enrollment period. And that's the time where you're going to fill out an enrollment form. You're going to gather your documents if you're covering a spouse, and you're going to get a copy of your Medicare card if you're over 65. For our current Kaiser members, the forms, there's an enrollment form that you'll need to complete, and that will go to the school district and they'll forward that on to us. You're going to keep your same medical record number. So for those of you who have had Kaiser for a long time, you know, once you enroll in Kaiser, you're assigned a medical record number, and that is your number for life. You can, you know, be born into a Kaiser plan, get a medical record number, not have it for 20 years, and then all of a sudden enroll again, and they're going to give you that same medical record number. Your Kaiser's only going to reissue you an ID card if you haven't had one in the last year. So most of you have probably been on Kaiser for quite a while, and you may not have had a new ID card mentioned or sent to you. With the Kaiser ID cards, they typically only have the medical record number on them. So you won't need a new ID card if you know that number, but don't be alarmed if you don't receive a new card. And then for those of you, as I mentioned before, who have assigned your Medicare, this is for over 65. If you have assigned your Medicare over to Kaiser, then we're going to get a file from Kaiser. Now, as of January 1st, if you're going to be a new retiree coming onto the plan, and you haven't been enrolled in the Kaiser Senior Advantage before, then we're going to have you do an election form to assign your Medicare over to Kaiser. But for those that are existing, rest assured, we're going to transfer, transfer that Medicare assignment. We just want a copy of your ID card, your Medicare card, not your ID card. And then new members will transfer. So the enrollment form that we're going to need for our Kaiser members, all Kaiser retirees will need to fill out this Kaiser enrollment form. And that's so we can get you into the SISC plan. If this piece doesn't happen, your coverage drops off with CalPERS, and never picks up again until you fill out this form and it's turned into the district. So the district will complete the top part. You're going to add on here which plan. With Kaiser Senior Advantage, we're actually giving you two options. An option of a $10 KIPSA plan or a $25 KIPSA plan. So you'll receive that information or be able to look at those benefit summaries as we get closer to October. You'll put in all your information in the center section and then add your dependents on here. If you have any dependents you're enrolling, be sure to sign the form and date it. And we have this electronic version of this that the district will make available for you to send out as well, or send back as well. And team, is there any questions with regards to this that I should be answering as we go along?
I think most of the questions we're getting are about how payments of the premiums are handled.
Okay, and I'll talk about that in just a moment. So we're good. Okay, so next slide, Brittany. This is just kind of a reiteration of what I was sharing. Your Kaiser Senior Advantage is an HMO Advantage plan with Medicare Part D prescription drugs. You need to stay enrolled in Medicare Part A and B. Members enrolled in Medicare assignment, in a Medicare Advantage plan, you actually assign your Medicare over. So we're going to get that transfer from Kaiser. SISC, you again must live in a Kaiser Senior Advantage service area to be eligible within the state of California for a SISC plan. Okay, traveling KIPSA members are covered worldwide for your emergency and your urgent care services. But if you move, we're going to have to move you to one of the other plans. You will no longer be eligible for the Kaiser Senior Advantage plan. And prescription drugs, as I mentioned, we're going to sign you up for Medicare Part D, but we're giving you the Kaiser Senior Advantage prescription plan. It's $10 for generic, and depending on which Kaiser plan you enroll, your brand name drugs will be either $20 or $25, depending on which plan you select, up to a 100-day supply. And there's no gap. Yes.
Lori, there's also a question that says the Kaiser Senior Advantage currently offers a taxi or Uber service to and from hospital and our medical offices 24 trips a year. Is that still included in this plan?
Yes, yes. The beautiful thing about Kaiser is Kaiser is Kaiser is Kaiser. Doesn't matter where you're getting it from or how it's being purchased, whether it's an individual policy or through CalPERS or through SISC, the benefits are the same. So you're good there. The only thing that may be different is SISC adds that chiropractic acupuncture rider, which allows you to self-refer to an in-network provider through American Specialty Health for a $10 copay.
Lori, I think the intent of the benefit committee was to also have that rider on the companion care plan. So if it was not in fact on the rates as quoted, we'll need to adjust that. But both for the chiro acupuncture, all that, a message I'd like to give the committee, the group here today, is that this whole shift is based on the premise that you'll keep your benefits or they'll be enhanced as a result of the change. So definitely appreciate sort of the questions at the detailed level about all those items, and we'll respond to those in the comments and in the chat. But as sort of a broad principle, really even down to like that level of like acupuncture cover, medical transportation, Meals on Wheels, whatever it is, we're making sure that all of those benefits stay the same or are enhanced.
To the extent that it can be. Sounds good. Okay, next slide, Brittany. Thank you. Okay, so companion care. Let's reiterate again some of the things that I had said. Companion care is a Medicare supplemental plan, also known as a Medigap plan. And it is administered by Anthem Blue Cross. So it is a SISC plan design, and Medicare is your primary. Companion care is your secondary, or it picks up on Medicare allowable expenses. So with this plan, we do require that you remain continuously enrolled in Medicare Parts A and B. The cost will not increase according to your age, but the premiums may be adjusted yearly, and that's the same for all of our plans. Members enrolled in the Medicare Supplement Medigap plan maintain your original Medicare. Okay, so as I mentioned, as of January 1, if you have assigned your Medicare over to United Healthcare or HealthNet or another plan that's offered by CalPERS, sorry, I had to find it, by CalPERS, it's going to be released. So then you're using original Medicare. So members you can self-refer to any US provider that accepts Medicare assignment. Okay, and that's anywhere in the United States. The members' cost share is 0 on this plan. So if you have a benefit that's covered by Medicare, it's going to be covered by companion care, and there's going to be no cost to you. And it covers up to Medicare allowable expenses. So if Medicare service is not covered, or if there is a medical service not covered by Medicare, then it will not be covered by your companion care. And there are some exceptions to that with regards to travel. Okay. If you want to know what Medicare covers, you can go out to their website and just type in "not covered," you know, under searching for benefits, what's not covered, and it'll tell you what few items are not covered by Medicare, just so you have an idea. And members must reside in the United States because we're working with Medicare as your primary insurance. As I previously mentioned, Navitas Health Solutions is going to be the pharmacy benefit manager. So your generics are $9, your brand name drugs are $35, and your specialty drugs are $35. And there is no donut hole or gap in coverage on this plan. Next page. So this is just another comparison that looked at it in the same view as we looked at earlier for the out-of-pocket expenses for the members. And you can see there is no out-of-pocket expense on medical services in general, as long as they're covered by Medicare. And then prescription drugs, as I mentioned before, you can get mail order service, and it's $18 up to a 90-day supply, or $90 up to a 90-day supply. Okay. Now, both the Kaiser Senior Advantage plan and the companion care plan, the Anthem companion care plan, we include a Silver and Fit exercise and healthy aging program that's free of charge. So there's no cost to you if you are enrolling in one of our senior Medicare group health plans. It includes gym membership at participating locations, home fitness program, and healthy aging resources. So you'll have information about that if you're interested in the future. Next slide. So these are our Medicare retirees, what you need to do. So in October, we're going to hold an open enrollment. You're going to fill out an enrollment form, and you need to fill out all required fields. So to get you into our system, we need your full social security number, your dates of birth, your addresses, your email address. And you want to make sure you sign your form. Okay, if you don't sign it, we can't enroll you. So we want to make sure you have that. We want a copy of your Medicare card. And then also dependent documents will be required, as I mentioned before. You're going to return all this information to the benefits department at your school district office. And whatever you elect during this open enrollment will be in effect until our next renewal, which is October 1st, 2023. At that time, you'll be able to switch plans if you would like, but you'll remain enrolled unless there's a qualifying event, like you're on Kaiser and you move out of the service area, then we'll let you change plans. So if you have any questions, you can contact the benefits department, or in the meantime, you can, before enrollment, if you have questions, you can contact me. And with that, I will turn it back over to Devin to share information.
Great. So a lot of the focus thus far has been on the Medicare plans, but shifting gears to the early retiree plans, which are the same as the active employee plans. I wanted to call out two things. One is the method by which the SISC plans were compared to the CalPERS plans. And the other is a couple highlights of areas where the SISC plan is superior to the CalPERS plan. So with respect to the method of comparison, what you'll find if you go to the district's benefits website and look at the benefit comparisons is you'll see the topic of area of coverage on the left hand side of the table. And then the two other columns will compare what you currently have with CalPERS versus what the comparable plan will be with SISC. In this instance, what we're comparing is the traditional HMO from CalPERS to the SISC HMO. They both have zero deductible. There's full coverage by the plan at 100%. Office visit copays have gone down $5, so that's marked in green to highlight the difference. And then the out-of-pocket maximum is significantly less. Out-of-pocket maximum is the maximum amount you could possibly pay for in-network services during the course of a year. You'll see that there's a different out-of-pocket maximum for medical than pharmacy, but in both cases, the out-of-pocket maximum is lower with the SISC comparable plan, which is better from a patient perspective. If we could go to the next slide, please. Similar here, there's a little bit more detail. I know that there were some questions earlier about to what extent are chiro and acupuncture covered. Here we see that they're covered with more visits at a lower per visit cost. These are some pretty big ticket items. We knew that chiro and acupuncture was important to the group, so we want to make sure that that was covered and called out. There's too many different sort of subcategories of coverage and too many different plans for me to run through this for all of them. But the benefits committee, which included classified and certificated representation, went through all of the different plans and all of the different things in detail. So that was the process. If we go to the next slide, you'll see again where it is on the website that you would go for more comparisons of the different plans. And if there's a particular line item, say it's durable medical equipment or what have you, you can look at the comparisons that are posted there. I'll turn it back to Lori to wrap up coverage of dependents, and then we'll get back and see if we can answer all the the questions and discussion in the chat. Please go ahead, Lori.
If I can jump in for a sec. Also, just so that everyone knows, this is being recorded. The whole thing will be on the same website that Devin just showed, the benefits section of the SEQ website. And what we've done in the past is all of the slides will be there also, so that you can look at them at your own time. And you can, slowly go through each form, because I know this is a lot of information in a short period of time. And it's meant to be quick and concise, so we don't take up a whole day's worth of stuff. But you can go back and check it out on your own time also, through that portion of the website.
Thanks, Chris. And so for our early retirees and retirees with someone who is under the age of 65, again, your open enrollment is going to be during October. You're going to have some different forms to complete than you would if you and your spouse or partner were over 65 with Medicare. It's going to be the forms that we use for our active employees. And we just want to remind you to complete the forms with your full Social Security number, dates of birth, your email address, your address, and don't forget to sign the forms. Plan election form. We're going to need to know exactly which plan you're wanting to enroll in. And we're going to need dependent documentation for your spouse and any dependent children, spouse, domestic partner, or any dependent children you're wanting to enroll. And these forms will also go to the benefits department. So enrollment forms, nothing is sent in directly to SISC. It all filters through the school district. And then once you're enrolled, whether you be a retiree over 65 or under 65 or have dependents under 65, in the prior slide where we were talking about retiree with lifetime benefits versus retirees without lifetime benefits. Once the district gives us your enrollment form and we have you in our system, we're going to send a welcome packet out to you, giving you information on the plan you're enrolled in and the cost of that plan, and then how you can make payments to SISC. So as Brittany mentioned earlier, SISC accepts online payment via our secure website. So you can set up to make a one-time payment to withdraw from your checking or savings, or you can set it up for a reoccurring payment, and that will be pulled out each month. Or you can send us a check, and we're kind of hoping to move away from a check or a money order for the simple fact that the United States Post Office is the post office is taking a really long time with mail now, and to get we're finding it's taking 3 and 4 weeks for our retirees to get their checks to us and for it to get processed. And so we're really encouraging members to use the online system if you can, or if you're more comfortable giving us a check or a mail order, that's fine too. So after enrollment, probably about, I would say a month to a month and a half prior to January 1, watch for that welcome packet from SISC. And then all your payments and everything will go through SISC. Okay, so any questions that I can answer, Chris, that are good for the whole group, or Edith or Devin?
Lori, with your permission, I'd like to share your contact information with the group, because there's a few who are like, is my doctor going to be included in the network? And I think you're the right person to contact. Yes. Yes,
absolutely. And I'll be happy to answer that. Send me an email. Oh, look at him. So this is my contact information. It's usually easier if you send me an email, because I'm going to need some information. I'm going to need to know which plan you're thinking about enrolling in. More than likely it's companion care versus Kaiser. But if you have questions about Kaiser, please feel free to send them. I'm going to need to know your provider's name, the tax ID that the doctor bills under, because that's really important. Some doctors have more than one tax ID number. And so you visit the doctor and yeah, they're in network, and then come to find out they're going to bill under a different tax ID number. So find out which number they're going to bill under and what location you like to visit that doctor. Because sometimes, you know, a couple days a week, they're over here in one area and at another medical group, you know, another time. And so just give me that information. Let me know what your questions are. Tell me whether you're over 65 or under 65, or if your spouse is over, under, if you have dependents. If you share that information with me, we won't have to go back and forth as many times. And I'll get you what you need.
Thank you, Lori.
You're welcome.
So I think we can start working our way through the questions in the chat. Maybe I'll open it up to Chris and Edith if there are ones that you wanted to call out. It looks like we've got a couple that are repeats, and want to make sure we get to the ones that are the most important.
I've been trying to answer as many as I can, but I feel like I don't have all of the answers, and I feel I don't want to mislead anybody. So I've only been answering the simple ones.
Edith, were there any that you wanted to make sure we got to first?
We've had a couple of questions about the availability of add-ons for dental and vision.
Yep. So, and I just typed an answer into that one as well. So for the Medicare retirees, the plan is to provide an additional policy. It'll likely be through San Mateo County Schools Insurance Group. We don't have all the information on it right now for this presentation, but it will be provided, and it will be at least as good as the dental and vision coverage that you had through CalPERS.
Looks like we're still getting
We got such a good showing. I know we have a few minutes left. I'd like to have you run down or run through the Q&A so we can just restate the ones we have answered, and then provide some clarification or just retouching, just in case we have some attendees who are not able to see the Q&A. Okay,
great point. Yeah, we'll start with the answered Q&A column. First one was, is the Anthem Companion Care a PPO? And yes, it is. Pretty straightforward. Next question was a scenario where my husband has senior advantage through the district. Does he have to reapply through Medicare? We're both in Kaiser. Please clarify. Looks like Chris answered that one. Maybe I'll give Lori an opportunity to respond orally as well.
Sure. So if we have an over and an under 65 couple and you're already enrolled, you will, your spouse who has Medicare will not need to reapply for Medicare. What's going to happen is he is with Kaiser Senior Advantage and he assigned his Medicare over to Kaiser. As I mentioned before, his Kaiser election or assignment is going to follow him over to SISC. Kaiser has actually agreed to give us a file for those retirees who have already assigned their Medicare. So we're not having you do that process again. So you'll be on the active plan for Kaiser and he'll be on the Kaiser Senior Advantage plan. And we'll just need to elect which plan he wants, whether it be the $10 Kaiser Senior Advantage or the $25 Senior Advantage.
So, thank you, Lori. And I think that probably answers that question. We got a question about timing on early retirees paying premiums and then waiting for quarterly reimbursement from the district. And yeah, broadly speaking, that same pattern that existed with CalPERS will continue to apply. I saw we also had a comment in the chat that had sort of some concerns about the time value of the money and people being out the money. So we'll have to take a look at that particular concern. But for the most part, the timing and the mechanics of how the premiums are paid is going to be consistent with how it was with CalPERS. Next question is Medicare subscriber currently using the UHC or United Healthcare PPO, wondering whether Sutter and Palo Alto Medical Foundation would accept from SISC. This retiree had already contacted those providers and asked them, and they don't necessarily know who SISC is. So the answer is yes. Sutter and Palo Alto Medical Foundation are in the Anthem network. So they're in the Anthem Companion Care product, which is for Medicare providers. So you're set. The next level of detail, if you care to check, would be at the specific doctor level. You could verify with Lori using the contact information put up earlier that specific doctor takes the Anthem Companion Care coverage. Sometimes different doctors bill under different networks. So sometimes it's better to check at the specific doctor level than just Sutter Health and Palo Alto Medical Foundation level. But again, Sutter Health and Palo Alto Medical Foundation are in the Anthem network. They're in the Anthem Companion Care product, which we put on that chart as a good comparable network to the United Healthcare or UHC PPO. We got a great question about, does this affect CalPERS long-term health? And no, it doesn't. So there is a long-term care program from CalPERS. This is completely separate, doesn't affect CalPERS retirement, and doesn't affect the CalPERS long-term care program. We got a question about the monies and how they are to be paid to SISC. So for those with lifetime benefits, the anticipated method by which the premium will be paid is that the district will pay SISC directly. So in that particular instance, it's actually going to be more streamlined for retirees. And so the question was, as a consequence of that, will I receive all my STRS benefits? I am not a STRS retirement expert. My focus is more on the health side, but logically I could say, yeah, that's right, because if it was coming out of your pension before, now it's just being paid directly by the district, there'll be more in the pension. I don't know if anyone from the district would care to comment more on that one. Okay, we'll move on. And Chris, thanks for jumping in on that one as well. We had, how does Silver and Fit compare to Silver Sneakers? Lori, I'm not familiar with all of those terms. Are those different names for the same program?
Very, very similar program. My understanding is that providers are more willing to enroll in Silver and Fit because the provider is paid without the member using the services necessarily. Where Silver Sneakers a little bit different. I've never done a comparison because I'm not familiar with Silver Sneakers and the details of the program, but my understanding is the reason why we went with Silver and Fit was because it had a little bit more substance to it than Silver Sneakers.
Thank you, Lori. We got a question about who do we give the form to? Great question. A number of forms were referred to. And so this will be in October. More communications will be sent out, including the forms themselves, along with instructions on who to give it to. Given the number of forms that the benefits department is gonna be processing, it may be that a third-party firm is brought in to help with collecting those. And the district is in the process right now of figuring out the most convenient way for those forms to be collected. So stay tuned. That district benefits website is a good place to come back and check, or just call the district and ask. But that particular piece of this is still in development. We want to share all the substantive changes as early as we could, even though we're still working on some of the mechanics of how the forms will be collected. We did have the question about Kaiser's taxi Uber service. I think that was answered orally by Lori. So yes, it will continue to be available through the Senior Advantage product. I think the way Lori summarized it was Kaiser is Kaiser, particularly with their Senior Advantage program and the bells and whistles associated with that. Next question was, I'm a Kaiser member age 77 and have lifetime benefits, Senior Advantage member, retired since 2006. Am I required to transfer to SISC? And is this an automatic requirement to shift from CalPERS to SISC? So Chris did answer this in the chat, and yes, everybody who's in CalPERS today for medical coverage will be moving to SISC for medical coverage. And to make sure that the process is seamless, there will be forms for you to fill out. So it's not just an automatic change. We are asking that you fill out the forms to select the plan that you want. And if it's a Kaiser plan, there's maybe Lori, you can say a little bit more about if there's other steps that the Senior Advantage folks are going to need to take.
If you are enrolled in Senior Advantage, or as of January 1st will be 65, and enrolling in Kaiser Senior Advantage, there's a Kaiser enrollment form we need you to complete so we can get all your information into our system. If you're already with Kaiser Senior Advantage, that's all we need. The enrollment form, a copy of your Medicare card, and any dependent documentation if you're adding a spouse who's also over 65 or under 60. If you are January 1st or later eligible for Medicare and becoming a retiree or turning 65 in January or later, then there's one additional form that you would need to complete. And Sonia will have that form. It's called a Kaiser election form, and that assigns your Medicare over to Kaiser. You do not need to do that if you're currently enrolled in Kaiser Senior Advantage.
Thank you very much, Lori. we had another question. We need to know how and what we are all over 65 must do to keep us covered by Kaiser. Just too many statements. So Lori, if you could boil it down to just one or two summary statements about what Kaiser Senior Advantage folks need to do one more time.
If you're Kaiser Senior Advantage now, we need an enrollment form, copy of your Medicare card, and if you have a dependent, we need dependent documentation. That's it.
Perfect. Thank you.
Mhm.
We have the, for those who might be reading down the list as I go, I accidentally skipped one, but it's a question about what specialists are in what network. So question was, I'm in the PERS PPO plan. Will I be able to see any doctor that takes Medicare? Confused because the slide said 95% were covered and concerned about not being able to see a specific specialist. I'm seeing in the PERS PPO Platinum. So there's a lot there. I'm going to just focus on this retiree specific scenario. So because she says that she's seeing the doctor in the PERS PPO Platinum plan, then we are 100% sure that that doctor is also part of the SISC companion care network. Whether the person takes Medicare is really a separate question, but we can also infer that if she's seeing the specialist through the PERS PPO Platinum plan today, that doctor does take Medicare because that's a Medicare Advantage plan through PERS, and so therefore will be part of the SISC companion care. So on both scores, whether it's the network or whether it's the coordination with Medicare, if you're in PERS PPO Platinum, you're all set. The one that the 95% applies to is United Healthcare UHC plan, and that's the one where you ought to contact Lori Phillips to confirm at the doctor specific level that the physician is in SISC companion care. We can be certain that they all accept Medicare assignment because all those current CalPERS plans are Medicare Advantage plans. Okay, moving on, supplemental dental vision. I had mentioned, so asking if it can be purchased separately by the retirees. The plan is for supplemental dental vision to be provided by the district. And it's not going to be through SISC, but more information to come on that. We had an attendee who raised the concern, my provider does not assign Medicare. Now what do I do? Without knowing the specifics, it's a little bit hard to tell, but I put Lori's contact information in the Q&A for that particular one at 1:50 p.m. So if for that person with a question or for others with similar question, email Lori. We've got some folks who were grateful for the information. Well, thank you for attending. I'm glad it was helpful. Will we be sent all this information? Chris pointed out that all the information will be on the benefits website. We looked at doing a mailing, but it would have been almost an inch thick with all the material that we covered, and with the concerns about timing on postal service deliveries, we elected to just send out a shorter mailing and then have all the information on the website. The thing that's nice about that too is in the event that we found something that was an error in the materials today, we can fix it. And so it's always the most up-to-date information on the website. Does Silver and Fit plan cover YMCA dues at all YMCA's? And looks like Chris, you might have grabbed some information on that one.
Yeah, just straight from the website. I just copy and pasted the info so they could look it up and figure out if the YMCA near them is in the group or not, and if they'll have to move to a different YMCA that is available in that membership group.
Way to go, Chris.
Thank you, Chris. Research on the fly.
I have Google Foo.
Yeah. We had a question. Does United Healthcare have only one option, Anthem Companion Care? SISC can accommodate other retiree plans. When my firm, Claremont Partners, did the benefit comparison, what our analysis showed is that Anthem Companion Care plan was going to be the best for all the retirees. That includes people coming from the United Healthcare plan. And so the two criteria that we used were, number one, the richness of the benefit that was provided, and then number two, the cost of the benefit that was provided. If you're in a situation where maybe your doctor isn't in Anthem Companion Care and need to find some kind of workaround, probably first step is call Lori at SISC to confirm like what's going on with your situation, and then we'll try to find potentially an alternative plan that would work better for you. Again, the intent here is for no one to lose anything that they had with CalPERS due to the shift to SISC. And SISC is very flexible and has lots and lots of options. Next question was prescriptions from Costco. Will we have to use Costco? No, you don't. Yeah, so this one was answered in the chat by Chris. So there's a special program at Costco where generic drugs are free. So go ahead, Lori.
I should say for active and early retirees.
Yeah.
They may not be free for the companion care.
Okay, so for actives and early retirees, that's where the Costco pharmacy can be really advantageous, but it's not required. For those who aren't aware, you don't have to be a Costco member to use the Costco pharmacy if you do want to take advantage of it for the active retiree, excuse me, early retiree plans.
And Devin, I will add to that to say that if you are enrolled in the Anthem Companion Care Plan, Costco is our mail order provider. So you would need to use mail order through Costco unless you are on a specialty medication, and then you would use Navitus Specialty RX, and they contract with a few different mail order facilities for the specialty drugs. And those are typically like MS or cancer medications or injectables. But
Okay.
other than that, regular maintenance would be Costco mail order.
Costco mail order. Thank you, Lori.
Mhm.
Then we had a question about how the Kaiser fees are going to be deducted from the pension or not deducted. So this one was answered in the chat as well, but you cannot directly pay premiums out of your pension to SISC. So that was a convenience that CalPERS had because the pensions were there. That's not going to be an option. So the methods that SISC has is you can set up online payment is probably the most convenient. It can be a recurring automatic payment. And they also have other ways that you can pay as well.
The reimbursements, we're seeing a bunch of questions for whether those are quarterly or monthly for reimbursement for retirees that are not under the lifetime benefits.
Mhm.
Do we know if that'll be quarterly or monthly?
So my assumption is that it will continue to be quarterly, but
Gotcha.
I think we have some other folks who might have some insight on the panel as well.
For right now, let's just assume status quo.
Okay.
Okay.
And then that reimbursement under the new plan will only be for the minimum contribution moving forward on members who are not lifetime. So when you pay your premiums, you're paying your full premium, you're being reimbursed quarterly only for the minimum contribution of the district. Am I saying that correctly? Does that sound right?
Yes, thank you, Chris.
Okay.
So I've made it through all the answered Q&A. Crystal, do we want to try to wade into there's 22 open questions as well. Do we want to start to wade into those as well?
I think with that last question, I think I covered a few of them. I'm
Okay.
gonna keep chugging away with answering them text and chat. So some of them you can gloss over if it has to do with the payments at least.
I do think there's a question about out of state that I don't think we've covered yet,
Oh,
unless I missed it.
yeah, thank you. So for out of state, there are a handful of Kaiser members who live out of state, and SISC does not provide out of state Kaiser plans. So if you're a Kaiser member and want to stay on Kaiser, you'll need to go through a state exchange or otherwise get an individual Kaiser plan in your state and then be reimbursed by the district. For the Anthem plans, I believe that they're all nationwide. But Lori, perhaps you can add a little bit more detail on state by state coverage on the Anthem plans.
So on the Anthem companion care, keep in mind Medicare is your primary insurance, original Medicare. So providers throughout the United States who are contracted to accept Medicare assignment that's your network. So you can visit providers anywhere throughout the United States. And then companion care will pick up secondary as your supplement and fill in on Medicare allowable expenses.
And Lori, just to confirm, I had it right. There are Anthem network providers in every state.
There are providers accepting Medicare assignment in every state. You're not actually using the Anthem network.
Oh, I see. Okay, so perhaps that's even broader. We'll move on. So we had the open question. I think we've addressed on the retirement deductions no longer happening. If you want to use your pension funds to pay for premiums, you can take money out of your pension and do it. But yeah, the automatic ones direct to CalPERS, those will stop, and you'll need to make a direct payment to SISC for those. Looks like a second question on automatic payment. I think we've addressed that. If your spouse is not considered a dependent, does spouse still have access to Medicare B secondary insurance. Lori, can you help with that one?
So I'm not sure what we mean by not being considered a dependent. So for SISC's underwriting guidelines, if your spouse, if you file federal tax return and you have married filing jointly or married filing separately, that's an acceptable dependent or spouse for coverage. If you do not file federal tax returns for whatever reason, if you show proof of marriage certificate, and then we have a marriage affidavit that can be completed for those who do not file federal tax returns, and those members would be dependents. Common law dependents or partners are not eligible. You either have to be married or you have to be registered with the state of California as a registered domestic partner to be eligible to cover those spouses or partners.
Thank you, Lori. Crystal, did you want to try to wrap things up?
So we had a great showing and obviously some great questions. All of these Q&As will be organized and posted on the website, as well as the recording from this webinar. I would imagine that we will revisit a lot of these conversations and give another opportunity for retirees to engage around this transfer, probably August, early September. Please make sure that we have your contact information, your correct contact information on file with Sonia, so that when we mail something that you can receive it, or if we can place a phone call. Depending what happens with COVID, maybe in the fall, we can also organize something to be in person. I know it's not always super easy to log on via Zoom, so we're just trying to create multiple different ways for our retirees to engage and have their questions answered. So please feel free to email myself, Chris, Edith, or Lori, your questions pertaining on where they are, and we'll make sure that we get those answered for you. But I want to thank you all so much for your attendance today. And please be checking our website for the most up-to-date information. So with that, thank you all, and we'll be in touch soon. Bye-bye.